I'm Leslie Cornwell, certified nurse midwife with Midwifery Business Consultation, and I have one of my new, I'm excited, we'll be good friends, I can definitely tell, Tammy Sen, and she has a few businesses, few different ventures, so I will let her introduce herself.
Hi, everybody. My name is Tammy Sen. I have been a certified nurse midwife and women's health NP since 2008. Most of that time I have spent in labor and delivery, half my life delivering babies. And about a year and a half ago, decided to take a step away from that. I am now the owner of Sensua Intimate Wellness, which I'm sort of forging my own path for taking care of women who need help with their sexuality.
How did you get that direction? I mean, to go catching babies all the time, I'm just going to teach about sex. Like, where was the transition? I know you and I talked off the radar about it, but I would love you to kind of talk about how that inner passion and drive of you evolved into a business.
So, I always tell this story of when I was a young nurse in the early 90s and having this conversation as girlfriends, talking about sex with each other. And the topic of faking orgasms always seems to come up. And we were having this conversation, and out of a group of about 8 women, I was the only person there who was opposed to this concept of faking orgasms. And they all said, well, a variety of reasons, it's just not going to happen for me today. And he doesn't turn me on, he doesn't do it for me. And I just want it over, which shocked me and made me sad. And I looked at them and I said, why would you do that? If you're not having orgasms, you need to speak up. And they were appalled at that point of view.
Really?
And then fast forward, after many years in the exam room as a midwife, I had had so many patient encounters where women had been abused and women had been brushed aside and had been humiliated by their providers when they tried to bring up sexual concerns. And there were tears, there were so many tears. And sometimes I cried with them because they felt like their lives were falling apart and no one would help them. And there was no one for them to turn. And when I would collaborate with my colleagues, even midwives and physicians who had years of experience, there was always this sense of, well, we don't know what to do. There's no information about that. And I just had this personal sense of helplessness and felt like this isn't fair. We need places to turn.
Interesting when birth is so connected to, like, we want woman empowerment and your sexual being. Like, if you don't feel empowered there, like, just like if you have a bad birth experience, if you don't have the sex, I mean, it affects everything about your well-being. And I'm surprised. I guess you and I are more outliers than I realized.
I've grown accustomed to being an outlier most of my life. And I've found, people think this is a huge disconnect, but I've found it's very intimately connected to how we birth. All midwives have had that experience with a client who's very disconnected and dissociated from their bodily sensations. And we see that a lot of times manifested with our high epidural rates, that we don't connect with our body, we don't associate what's going on, we just see this as a problem when we have sensations. And that same sort of body disconnect translates into the bedroom and into our sexuality. And really, it's a cultural setup. As women, we are taught to monitor our bodies and our behaviors in so many ways. And we don't realize it. And it affects us so deeply in our everyday life.
Yeah. There's so many thoughts and so many directions I could go with that conversation. It's like, okay,
we'll go
on the business today, and then we'll have you back on in 2 months and talk about, like, the history of just the whole cultural dynamics, because that's a whole realm all in itself. Like the education access, the stigmas involved, oh my goodness, we could just go on and on about that. But I think today, for inspiration, so many midwives I hear across the country, the birth call is such either where they are in life or the demands or whatever the situation, they're craving business conferences where they don't have to be on birth call, and there's dozens and dozens of them. So I would love for you to talk about how you've transitioned from being full scope midwifery to finding your love and niche and how you set up that practice.
I didn't jump immediately. I took several years to find the training that met the needs for the kind of practice I envisioned. And I bring my midwifery philosophy to what I do. I don't feel, medications are the answer to some people, but they're not the be all end all. And usually it's much more complex than just handing out a medication or a magic prescription. It's a process. And so what I did is, when I was working for a large practice, I obtained the education. I started writing my business plan, which took me quite a while. And I started practicing. I talked them into letting me do a few sex visits there to dip my toes in water and experiment for myself and see how it would work. I had meetings with our billers and coders to see how to maximize my billing process, to see what insurance companies would pay for, because this is not a huge moneymaker in the big scheme of gynecology. So I fine-tuned all those things, worked with what works for the client, what doesn't work in an office setting, and sort of had a really good idea of where I wanted to go before I left the private practice. So I did sort of use my time there as a guinea pig and use the resources that were available to me to learn before I took the dive.
Yeah. And I tell so many midwives, side hustles, like to jump into something. Maybe it's not going to be a good fit, or you work out the irons or the kinks, but not to feel the financial pressure from your startup business and having it as a start. And that's what I think is so amazing is you could say, okay, I'm going to do Saturday morning clinic for 6 months to a year while I've got this other revenue stream. It makes such a huge difference. So yeah, I love that your practice was so open and you could be comfortable and leverage the opportunities. And I'm sure it made a huge impact when you transitioned. It was professional. You've now got a strong referral basis versus, yes. I think so many midwives feel, well, I can't talk to them about it because I'm afraid they'll fire me. Like that scarcity mindset. And I'm like, well, maybe it wasn't a good fit if you tried to have a conversation and that's your worry and fear. But you want a long-term relationship. You don't want to be trying to do stuff behind the table they're going to eventually find out about. That's not, you want to work in that community. You want to collaborate with that practice you're part of.
Yeah, they were eager to bring these services to women because they felt the same frustration and sense of helplessness. And, these are time-consuming visits. And when you're working on RVUs, they were eager to send me the time-consuming visits, which meant in the big scheme of things, maybe I took a small pay cut while I experimented. But as you say, the end game was worth it to learn and take that opportunity. And now they're one of my best referral sources. We used to work with her. We know her. We trust her. We know the training that she received. And I gave them some training before I left, which also is helpful. So now they have enough of a base of information to know what I can offer and who's appropriate to send to me. So you just have to find ways that are mutually beneficial to look at these opportunities. It's not only one piece of the pie kind of game. There's plenty for everybody. We just have to learn how to work together.
Well, and I think referrals are so important, but for something that you can't just put a giant billboard up and say, hi, I do sex education. Like that's kind of, it's this taboo office that you need those referrals even stronger than another midwifery minded business does. So I think that was very wise what you've done. What are other ways you've done in your marketing campaign to make awareness of your services?
So mostly I'm dependent on referrals. A lot of it is pounding the pavement so that I get a name and a face, and here are my referral packets, and developing a referral packet that gives very thorough information, because I find it's such an unusual niche. And I'm not a sex therapist. I'm a certified sexuality counselor through the American Association of Sexuality Educators, Counselors, and Therapists, which is an organization that has, in my opinion, very high ethical and training standards. And that's why I chose their certification. A lot of my marketing is educating, pre-educating other providers, because women have been told for so long, you just have to live with this, that when I say I offer a resource that can help you, they can't wrap their mind around it. And providers are often really relieved to have somewhere that they can say to their clients, I know just the person to see you. I also have a webpage which really thoroughly explains things, sentua.com, and you can certainly visit and learn more about what I do and the services that I offer to clients, about the training that I have lined up. I do occasionally blogs. Right now I'm doing a sexual health book club. I meet with a group of women, and this is an inexpensive way for women to get their questions answered. It's a less intimidating way for them to meet me without coming into the exam room and having to bare their soul and their entire intimate lives.
And imagine telling your partner, what's your visit for today, honey? Like that's a lot. Like if you got to get a babysitter and you got to quote unquote maybe make something up, or now they see some information, like, yeah, a more laid back approach to come and get to know you and learn more.
Yes.
Smart.
Yes. I've designed several classes. The next one I'm going to offer is for parents who want help in how to talk to their children about sexuality. Because nothing strikes fear into a parent more than their child's sexuality.
We must be outliers again. That don't scare me, but I guess it's how you look at it. I mean, I grew up in a household that was always open, whether that's good or bad, but I think that's where a lot of the taboos, like whether it's drinking or sex, like these unplanned pregnancies or overdoses or whatever it is a lot of that education and how the parents perceive, or we don't talk about it, doesn't happen. And I'm like,
right.
Yeah. So it's very interesting how getting to the parents and giving them an education, maybe their own internal taboos to get past, to be able to help their children.
Well, and I find that was a common question. I would do annual exams for mothers of middle school aged girls. And at the end of the exam, the questioning would turn toward, I have this daughter. When do I start talking about this? When does she need to come see you? When should we? And so again, nobody gives us guidance, and our sex education in this country is absolutely abysmal. There's such a hunger for accurate information. And what I found is that even in our educational program, it is incorrect and it is incomplete.
You just got to become the national expert of sexual health. We'll label you that, Tammy, for all the midwives to go to. There's such, that's what's overwhelming. You and I talked off the radar. There's so many opportunities out there. If you know how to look and you have confidence, you can fill that void. I think my whole point of these YouTube channel and in the inspiration of the resources is to inspire midwives, inspire women to think outside the box. What do you love? What are you passionate about? And where are there needs in your community? There's so many out there. And so, yeah, I feel like sexual health is just like a core of a midwife, empowering women, because I mean, Ina May has talked many, many times, like the kissing and the love, like what gets the baby in, gets the baby out. And there's not enough respect for the sexual being of a woman, or that taboo of can we comfortably talk about it. And so I think you're going to break a lot of barriers, and I'm so excited for what you're doing. And how do you feel after a year and a half of your business being open? Do you feel like it's growing at a steady pace? Do you feel like it's growing faster than you anticipated?
Well, the pandemic has definitely altered my business plan. So I would say for that alone, things have gone more slowly than I anticipated. But in some ways, I'm actually grateful for that, because it has given me the opportunity to work out the kinks without it becoming crisis level. Because no matter how much you plan, there will be things in your business that you didn't foresee and that you didn't prepare for. And if you ask my partner, he will tell you that I prepare for things that are never going to happen. but there have been things that have come up, and I was, happy to not have a full patient load, to be able to have the time to figure out, okay, how do I better handle this in the future? And sometimes you rethink the way you offer services and retool it so it better suits the needs of your client, and so that you have better boundaries, so that you don't get into this crazy burned out situation that you were trying to get out of.
Well, we think, oh, I've got more control, but then if you don't have those good professional development, work-life balance, giving yourself a vacation, I think that's the other thing with a job. Be like, if you don't use it, you lose it kind of attitude. Oh, I'm going on vacation, they're paying me. If you don't set it up in your business model, give yourself benefits, give yourself vacation time. You just keep saying, oh, I'll do it later, and then it never happens. So that's so important. I think when you were talking about the revenue stream not being as strong with sexual health, I loved what you talked about off the radar about the supplies, the equipment, having a boutique shop within your practice as other revenue streams. Like, I think so many people get discouraged. I can't do mental health. I can't do a private home birth practice because I don't want to do the assembly line. We want quality. And so I try to get people to think, what are other wonderful things that encompass ancillary services within your passion that may be a little more profitable? So if you want to expand on those things you've been thinking about.
Yeah, so I haven't set it up yet, but one of my goals, once I reach a certain threshold of clientele visits, is to set up a curated boutique of products that I believe in, that some of which I use myself, some of which my clients have used with great success, things that are well made, reputable, high quality, good for the vaginal tissues, not damaging. And just have them pulled together, because there is so little, basically no regulation for most sexual products. And so it's very hard for consumers to sort through what ingredients are harmful, what ingredients are not. Even if you're just buying a simple vibrator or vaginal dilators, it can be very difficult to tell how to choose them and what will be a safe choice. And so I feel like if I can bring those together and say, I recommend these, and they're available from me, because I already have clients who are like, I want to buy this, but I don't want to get my name on all these really seedy websites.
Like we were giving the example of grandma, oh, honey, go get my mailbox, and then you got some subscription because you bought a one-time thing. Yeah, I think it's beneficial to have an expert they can trust, and that, I mean, like, a lot of our ladies are very like, what are the chemicals and how do I clean this? Like, there's no like instruction manual on the details. And so you're kind of guessing and hoping you don't get like, yeah. So I think there's such an opportunity. And like you said, there's just, sometimes it gets overwhelming because you want to prioritize with your business. Oh my goodness, there's so many directions I could go. And you have to step back and be strategic and say, okay, which one makes the most sense to start small, low overhead, will meet the masses, and then I'm going to narrow down. You're going to do like a niche on top of a niche attitude.
Right. But I don't want to have too much cash tied up early in the business. I want to make sure that I have a pretty strong cash flow before I start investing in something that may not have fast turnover. So you're right. It's all strategic thinking. It's stopping and thinking, where do I want things to go long term, but how do I have adequate cash flow in the short term?
So if you want to expand, because we were talking about strategic, what is your big vision? And then how did you break it down in your business plan to your timeline and goals?
So I am 53. And much like many midwives, I'm looking forward to a time when I don't want to be doing night shifts. I don't want to be doing 24, 48, 72-hour calls. So I'm at a point now that I've been able to stop doing those things. Full disclosure, my business is not my total income. So, I don't have that freedom yet, but I'm okay to grow it slowly, because this is what I see as a way to still serve the women I want to serve, do something I really enjoy, and move into my retirement years and beyond with something that's fulfilling both personally and financially. So I really just started looking at, when I was working for someone else, how will the cash flow of the visits work? I don't accept insurance. That was something that I debated and did a lot of research into before I made that decision. And people get really nervous about the idea of not signing up for insurance. But the idea that I kept coming back to when I would talk to other people or look into resources is, if you're accepting insurance, you're just trading one employer for another. You've got some other corporation who's telling you how to run your business and what your daily workflow must look like. And I didn't want to do that, especially with sexuality, because it goes so quickly off the rails when someone else is calling the shots.
Yeah, when you're being told how you have to treat or what you have to talk about and what the documentation is. And it depends on what sector you pick, because if it's things with the Affordable Care Act, if you're starting a contraception office and all the competition is 100% covered, I mean, and that's the thing, like mental health, these unique niches, it's more cost effective for the families and for you, and stressing the benefits. Like I can't stress enough, if you show the value, you do good marketing campaigns, you find the needs, you find the women looking for this, they will pay whatever because they've been wanting it. So I think it's good you brought that up, that you don't have to instantly think, well, I have to do insurance. And if the numbers don't add up with insurance, like let's play around with the cash numbers and see what's in the area and what your competition is even offering if it exists. So I think that's wise that you did that.
I did a lot of that. And the other thing that I break down for folks, especially colleagues who are concerned about this, when I was working for someone else, clients would pay a $40 to $50 copay to see me for 15 minutes. I now see them for a 60 to 90-minute visit, because 15 minutes would never work to talk about sexual concerns. And even sometimes after 90 minutes, we haven't even begun to scratch the surface. My cost for that 90 minutes is less than what they would pay if they came to see me for 6 15-minute visits. They come see me one time. They don't have to take off work 6 times to come see me. I have flexible scheduling. So it's, again, and how you educate your consumer and what you offer to them. And a lot of people see that as a very valuable way to get their care.
So what are some common things you've seen or focused on with your services that are coming up with women? I know we had briefly talked about just the culture of faking orgasms and the inability to have orgasms, but what are other common things that you're seeing or part of your discussions you're having when you're figuring out there's a consistent theme happening among women?
I think the most common thing is decreased sex drive. And that can be, it's never one thing. It's always very complex. I do a biopsychosocial approach. At that first visit, we go through your health history. I look at your medications. I look at procedures and illnesses. We go through everything, and then we start looking at social aspects. We look at your life stressors. So I get things everywhere from, the very simple, we all know about SSRIs and their impact on your sexuality, but a lot of times women don't realize I'm having difficulty lubricating. Well, that's probably in part because you're taking an antihistamine. Simple solution. Let's talk about lubricants. Let's talk about your anatomy. I do so much education with models, clitoral models and vulvar models, talking about different ways to be sexual, talking about our anatomy and how it actually works.
I was just going to say, like, the health classes are barely taught anymore. Women don't even know their basic anatomy. Like, you do a whole class about, like, okay, this is the most sensitive area. This is the G spot. This is where the tissue, like, people don't understand, because I mean, you and I could go on and on, like, just some of the challenges of being able to openly communicate with our partners or whoever that is about what you're feeling and what is good and not good. Because I promise you, the other person on the end, they just want to make you happy. Like, they don't want to fake happy.
Well, and I find we get so much anticipatory guidance with procedures and chronic illnesses, but nobody ever tells us how it's going to impact our sex life. I've never met a cancer patient who didn't have a major impact on their sexuality, and nobody warned them that it was going to happen, and nobody gave them any tools for how to preserve a level of intimacy with their partner.
Yeah.
And that's so needed. How would our healthcare system change if we just added that one component to cancer care?
Oh my gosh. Yeah, I have so many ideas going through my head of just the education and the awareness and the comfortability with the providers and getting our own biases out, and feeling like when we talk about interaction of medications and cardiac, why isn't it on that side effects of deeper, like, okay,
Right,
in talking
right.
about you have a decreased sex drive from XYZ medication or a treatment you're going through, and what can we do to help you with it?
Right. And just like men, we have substantial erectile tissue in our genitals. Nobody talks about that. But if a man is having difficulty with arousal, we talk about his perfusion. How many times have you talked with your diabetic patients about perfusion of the clitoris and how it's going to impact their sex drive?
Interesting. Oh my goodness, girl. You have
So many places we can go.
we could. And so my intention, I will have you definitely on, I will go more down the rabbit hole, but I think, I appreciate you being open and talking about your business. I want more, like people are talking about, I want more birth centers, home birth practices. And all I'm thinking is my head is I want 30 to 40 in each state of your practice, and a woman and breastfeeding. And like, there's a couple midwives doing postpartum clinics, and like, I want midwives to think outside the box. There's so much opportunity out there. There's so much to collaborate and support each other in all these niches, and the power we could put across the country by just being, we don't have to be part of the system if we don't want to be, but figure out who you are and what makes you happy, and how can we inspire that into a business model. And so I love what you've created. I wish I could find more midwives doing what you're doing, maybe your inspiration, and talking on the sidelines of creating a business course for midwives, because I get questions all the time how to do it, and it's not my expertise. I can tell them the basic business model. So I appreciate any advice you would give anybody thinking of starting this type of practice, any tips or things, those words of wisdom to finish our conversation.
So number one, first and foremost, I need a lot of practitioners who find this intriguing, do the work to get the education. I thought I had a very good idea. I thought I was well educated in sexuality. I thought I had a very open mind. And I looked for 4 years for the educational program that gave me what I envisioned my practice to be. I learned so much and realized how much more I still had to learn. So, number one, if you think you're going to dive into the world of sexuality, get a good education in sexuality. Number two, before you open any business, get really clear on what your own limitations are and what you need your boundaries to be. Because at least for me, those can be, I want to do everything. And you have to accept that you can't be everything to everybody. And you have to be very realistic about what your vision is and how to make that happen, or it can just go crazy too fast.
You spend so much time planning, and then you get in the paralysis analysis where you're just like, I could do this, I could do this, I could do this. And you're just thinking about all the things you can do, but you're not actually creating anything. So
Yes.
it's a dangerous, slippery slope. And yeah, I think that's why you and I get along, because we have very similar.
Yes.
Well, thank you, Tammy. I'll put, what's the best way for them to contact you? Is it the number on your website? Is it email? Just, I'll put that at the bottom of the content.
So my website is sensua.com. That is sort of a play on words of my last name and sensuality. You can also get to my website by typing in tammysen.com. And my email is contact@sensua.com, all on my webpage.
Perfect. Well, thank you so much for your time today, Tammy, and you have a wonderful rest of your day.
Yeah, thank you for having me. It's great to talk about sex.
I know. I was going to say, my husband's going to be like, okay, I want more conversations. You got to talk to Tammy more. So
Call me